Welcome to Functional Mind. We are doing an Ask Us Anything series. This is episode 2. I'm Dr. Achina Stein, and with me is Vincent Petronelli. He's a nurse practitioner who's joined our practice a few months ago. And we've got two questions. One is a little very complicated. We'll start with the simpler one. And basically, the question is, can an electrolyte imbalance impact hormones and vice versa? And initially, I read that question as, can electrolytes cause a hormone imbalance? And I think it would be good to review that just to make sure that people understand that after our discussion about how electrolytes imbalances can impact hormones, that people aren't afraid to drink water or fluids with electrolytes in them in certain conditions. So, yes, the answer is yes, electrolytes and hormones influence each other in both directions, but I'm going to let Vin answer the question because he just had an experience yesterday that he was just telling me about.
Yes, absolutely. So exactly what you just said, they definitely can impact each other for sure. And yes, it's funny because my wife and I were just talking about it last night, uh, about the fact that a fun fact is that when it's really hot and humid, horses actually can stop sweating. And so we were asking a little bit, we're talking about like why is this and why does this happen? And so we were kind of looking things up, and I was explaining to her what was going on a physiological level. So there's this bidirectional relationship that electrolytes and hormones have. These are all signals that are constantly happening within the body. So with electrolytes, if we have a decreased electrolyte, we're sweating out a lot of electrolytes, whether it's really hot out, we're getting a lot of exercise. Essentially, there's like a, a stress response that occurs in the body, and your body will basically release a little bit more stress hormones. So things like cortisol, aldosterone, insulin, things like that will take precedent, and your body will prioritize those hormones, and release, and you get a little bit of a bump in these stress hormones. That's important because what we know is that the body will prioritize these survival hormones over some of your other hormones that, like your reproductive hormones, that are a little bit more downstream, including the thyroid to some degree as well. So if
Mhm.
there's this stress response that's going on, we're exercising excessively, we're doing too much sauna, and we're not replacing our electrolytes, your body will interpret that as a stress signal and release some of these stress hormones, which can impact downstream the thyroid and our reproductive hormones. And vice versa, there are conditions that stem from hormones, things like SIADH, which impacts ADH release and can impact our sodium and potassium release and cause like a decrease in our sodium, for just as an example.
Right, right. Yeah, I mean, kidneys control a lot of the sodium and potassium, retaining sodium and excreting potassium by a hormone called aldosterone, while it's ADH, which stands for antidiuretic hormone, and that controls how much water the kidneys retain. Um, so when people drink alcohol, that inhibits ADH and or antidiuretic hormone. That's why people urinate quite a bit. By the way, mold also inhibits antidiuretic hormone. And that's why if you have children, I mean, lots of adults can wake up in the middle of the night to urinate, and that's for other reasons. But children really shouldn't be waking up in the middle of the night to pee unless they are drinking a ton of water right before they go to bed. But generally, I think mold toxin illness because mold definitely inhibits ADH, and for a child to wake up in the middle of the night, especially multiple times, that I think mold. But yeah, so and then there's other hormones like parathyroid hormone and vitamin D that regulate calcium and phosphorus and magnesium. So and then there's adrenal function that can manage potassium and sodium. So there's different things there's different things that can regulate these issues. And so I think and like you said, the reverse is true as well. And there's lots of symptoms that people can have. Dehydration is the most common one. So that's why it's really important to have electrolytes, especially if you're outside in sports, hot day, running, 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 like I did this weekend. Okay, just returned from nationals in Colorado. We had 3 hot days, all in the 90s, sometimes in the hundreds, and playing lots of games. And so you have to be very, very careful about your electrolyte balance by taking electrolytes. And so I want to make sure that people understand that taking electrolytes, it is an individual thing and it should be individualized. There are different formulations for electrolytes. So you will want to make sure that you're on a, what's the word I'm looking for? A balance of them and not too high. You want to make sure that you're not taking something with too much potassium. I think that's really the one that you have to be super careful about is potassium. Um, Trying to think if there's anything else that I want to say about that. But generally, just so you know, generally like an electrolyte drink taking daily is not likely to cause a hormonal imbalance. It would really have to shift it a lot unless you're like taking too much. Obviously, you don't want to take too much electrolytes. And your kidneys will let you know for sure.
Yeah, your electrolytes are important cofactors for a lot of different cell processes. So you need sodium and potassium in the cell, and there's this constant balance that's going back and forth between them. We know that magnesium is a cofactor for many processes in the cell, so it's very important that we replace magnesium. Magnesium, is more and more difficult to get magnesium from our diet just because the overall nutritional status of our food has gone down over the last 50 years or so. There's some studies showing that the content of our nutrients in food in the 1950s and 60s is vastly different from the nutrients in foods that we see today. So of course we can get a lot of our electrolytes from foods and our micronutrients from foods, but there is some degree of decline in some of this due to the farming practices. So sometimes
Mhm.
we do need to replace these electrolytes with electrolyte replacement, whether that be like an LMNT or a magnesium replacement. But I think to your point that it needs to
Mhm.
be very individualized. And,
Mhm.
the old motto of test, don't guess, I think is really important here with electrolytes.
Mhm.
Another point to make is I know that with sodium, we have to be very careful when it comes to blood pressure. And yes, too much sodium can certainly impact blood pressure. So if you have hypertension and high blood pressure, you have to be cautious with that, especially with something if you have heart failure. That's very, very important to maintain that low sodium diet. But with that being said, in a normal physiologic state, when we're hot, when it's humid, when you're exercising a lot, um, being hydrated will decrease that effect on blood pressure, meaning that if we are, as long as we're drinking enough water with the sodium that we're taking in, it impacts blood pressure less. So making sure that we're nice and hydrated and not just having like a packet of electrolytes, but really mixing it in water to make sure that we're fully hydrated is really important, and you'll get less of that stress response, so you can have a more balanced hormones throughout.
Right, right. And I mean, we've talked a little bit about when to use electrolytes, especially daily. If it is that you're an athlete, you're sweating a lot, you're prolonged, athlete in the sense that you have prolonged exercise as well. But other situations that are not necessarily performance or athletic is if you have chronic diarrhea, so if you're losing a lot of fluid through your bowels, it's really important to take electrolytes. If you're on a ketogenic diet, so eating a really low carb diet is a absolutely should have electrolytes. And in fact, if before you even start a low carb diet, you want to start with electrolytes first because you really use a lot of the electrolytes by going low carb. So, and that will also prevent you from having having problems with the ketogenic diet. So some people have a lot of difficulty keto adapting. One way to prevent that or lessen that issue is by making sure you're taking good electrolytes. So the other thing that comes up when I talk about with electrolytes with people are some of the added things that you want to be careful about when choosing electrolytes. Is sugar, making sure it doesn't have added sugar. So sometimes that will affect your glucose and insulin levels. So you really want to, especially if you're diabetic or have insulin resistance, you want to make sure there's no added sugar. The other thing is that some people have trouble, a lot of these electrolytes solutions have stevia in it, and stevia can actually cause bloating in some people. So there are a couple brands. Gosh, I think one is called Source Minerals that doesn't have stevia in it. The brands that we like, I've in general like SOS because it just has a nice flavor to it. There's Noon, Nuun. There's LMNT, as you mentioned. And what else? I'm trying to think of are there any other ones that come up? I feel there's one called Nectar as well. There's one called Nectar that has a nice taste as well. But the only one that I could find that doesn't have stevia in it is Source Minerals dot, and it's from the company sourceminerals.co. All right. Think we hammered that enough. So let's go to the next question, which both Vin and I, this is not our specialty. I hope I can give you a general diagnosis. So Dawn asks about her daughter apparently just got diagnosed with lichen simplex, and it says vulvania, but I think you mean vulvodynia. And you're saying, I really don't understand the lichen simplex. What could be causing it? The doctors don't know much about it, they say. She is autistic and has other things like seizure disorder and just got diagnosed as a diabetic. She's in severe pain every day, all day. She finds comfort in the tub and nothing seems to help her. Please help me to understand this and what causes it and what cures it. So Dawn, I'm really sorry that your daughter is dealing with so much pain. So lichen simplex of the vulva, it's not an infection or cancer, and it's different from lichen sclerosis. And it means like that the vulvar skin has become chronically inflamed and thickened. Usually it's like this itch, rub, scratch cycle. And I mean, I am a little surprised that she's in that much pain from this, because unless she's itched, rubbed, and scratched so much that she's causing bleeding and tearing in. I mean, that's a sensitive area and tearing into the tissues. I mean, I have seen people do that. So, it could be so bad that that she's not able to contain herself and prevent herself from doing that. But once the skin gets irritated, it becomes more sensitive and more itchy, and it just leads to this cycle. So it's thinking about what's triggering the cycle, and it could be a lot of things. It could be, she's allergic to soaps. Hopefully, she's not using bubble bath. There might be wipes. There's detergents, the sanitary pads if she has her periods and she uses sanitary pads. I mean, even tampons can cause that. If she has urinary issues and she wets herself even a little bit repeatedly, that can cause problems. It can lead to like yeast infections or some kind of irritation. So it's thinking about what's irritating the area. So eczema is a possibility. Or like allergic contact dermatitis, if there's something that she's wearing that, like, I mean, I don't know if there's a lot of people are allergic to wool, but I don't know if there's such thing as a wool underwear, but even synthetic types of underwear could be a possibility that she's just, or if the underwear is too tight. So thinking about loosening up the underwear. But yeast is a major factor in terms of chronic yeast infections that can cause like a fungal jock itch, for example, jock itch. Sometimes people think of just athletes getting jock itch, but a lot of people can get jock itch, especially if they're very heavy and there's like just no air around the area. So, if she's able to wearing a dress without underwear in the house where nobody's gonna, she's not going out, and she's able to sort of air out the area, just putting air and drying, keeping the area dry really makes a difference. And sometimes there is pain that can irritate the skin as well. So if she's having vulvar pain, then that can irritate the skin as well. So I think the best thing to do in this situation is figure out what's causing the itch, if it is itchy, and to stop that cycle as much as possible. But I think if it's pain and it's real pain, and I don't know if you're able to observe the area or if she can describe, if she's bleeding or if she's got lots of scabs, then that would tell you that she's probably scratching so hard that the tissue has gotten so painful and that might cause pain. But I'm thinking that you were talking about vulvodynia, which is very painful. So, and that might be the thing that's actually causing her the pain that you're talking about. And, I would recommend that she actually see a specialist. There are actually vulvar specialists in the gynecological realm. And to really figure out if this is actually lichen simplex, you can do a biopsy or they can do a biopsy of it and make sure that that's actually what they're dealing with. I've had patients who've had planus and it's hard to diagnose. I mean, I'm not a dermatologist. I could never be a dermatologist because everything looks the same to me. But, I would imagine even for dermatologists that, sometimes they just don't know and they're not guessing. Obviously, it's a educated guess, but sometimes they're wrong. So you may want to really nail down the diagnosis and make sure it is indeed lichen simplex. And the other thing you may want to do is have her get a, pelvic floor assessment too, because that's sometimes the treatment for that if it is a pelvic floor problem causing the pain. I often see women with, and it's women more than men, with a subluxation of the pelvic cage, and that can cause incredible pain. It's like a groin pain, and it's not necessarily in the vaginal area. So you might want to also just talk to your daughter and ask, where exactly is the pain? Like point to it. And if she's pointing to like where the sacrum is, and where the pelvic bone is, the vagina is actually between the sacrum. Let's say if they're standing sideways between the sacrum and the pelvic bone, you can actually feel those bones and ask her, is it in on the pelvic bone? And if it is, that's a completely different problem. And that kind of thing is happens from falling or bending over. Again, especially if you're a heavy person and you don't bend over very much or do things like raking or mopping or sweeping, that kind of motion can actually cause a pelvic subluxation. And so you might want to just make sure someone really sits down with her and physically examines the whole area, to make
Yeah.
sure. And rather than just kind of taking her word for it that it is the vagina, or the vulva, which is part of the whole vaginal architecture.
Yeah, I mean, something that I would just add to that is, that area obviously is very sensitive. And it's, just to take note that they said that the patient was recently diagnosed with diabetes,
Hmm.
which that area around the vulva is very sensitive to yeast and fungal infections. And when we
Right.
have a higher blood sugar, there's a higher risk for these yeast and fungal candidiasis type infections down there. So that can be very itchy. and very irritating, which again, to speak to your point about, rubbing, scratching, and just causing that whole irritation. So
Hmm.
there could be an element of making sure that we're really regulating blood sugar tightly and keeping that very well controlled. Because if we're not well controlled with our blood sugar, we're going to have increased risk for these yeast infections. And it's that area is very common to get yeast infections when we're diabetic.
Hmm. And also, if you have diabetes, it takes longer to heal. So,
Exactly.
yeah, I mean, there's a lot that we can do systemically to lower inflammation and improve insulin resistance, insulin sensitivity, I mean, and get away from insulin resistance. So, I mean, diabetes can be mild, moderate, or severe. So, if she's already on diabetes medication, then it's probably severe. Um, Anyway, yeah, I think the best thing to do in this situation is to get a specialist. And I wouldn't wait. This is something that really needs to be handled um, ASAP, especially if it is severe continuous pain. That to me is a red flag to having a specialist take a look at her.
Yeah, if the area gets opened and especially if she's autistic or has issues with communication, or
Mhm.
perception of pain, communicating pain, I mean, and she's diabetic, there's definitely a high risk for infection, if that area is open at all. So, that's something that I would definitely recommend is getting a specialist involved and making sure that someone's doing a very thorough exam of that area.
Hmm. Absolutely. All right, so we only had two questions today. I think it's great that people are sending in questions, and I would love to hear more. I really appreciate your time, Vin, for joining me
Of
today.
course. Thank you.
I'm looking forward to more questions, and I hope these are helpful for the people who ask them. Thank you so much, everybody. Take care.
Thank you. Thank you.
If you like this episode, please click the like button and subscribe.